How's it going, guys? Today we're going to be doing a spine evaluation. Today we have Hank Galler here. Hank has been suffering from low back pain and pain radiating down his leg. Today we're going to do an evaluation on him and see what's the main problem. All right, Hank is a pole vaulter. He was pole vaulting 2 weeks ago, and he started feeling pain in his lower back. And then, like I said previously, he started radiating down to his leg. So we're gonna go ahead and start with our history. So, how is your pain like local, or obviously it radiates towards your leg? Is it more local towards your leg or more local towards your back?
Well, it kind of starts on my back and moves its way down to my leg, and yeah.
Okay. Is there any activities that you do throughout the day that alleviates or increases the pain?
If I stretch it, if I stretch like the back of my hip, it'll feel better for a little while, and then if I do any kind of lifting or when I sneeze, it hurts a lot. It hurts pretty bad.
Okay. And then on a scale of 1 to 10, 10 being severe pain, where would you rate your pain level at?
When it's at its worst, probably like a 7.
Okay. All right, so then we're going to go ahead and move on to observation. So we're going to go ahead and observe his posture and observe his walking gait. So we're going to have you stand up for me, please. So go ahead and face me. So we're going to go ahead and evaluate his posture. As you can see, he has slight forward head, maybe with the sweater on, but you can't really tell. Maybe a slight kyphosis. And pretty much that's it on his posture. Maybe go ahead and just walk there and back. As we assess his walking gait, go ahead and come back. His walking gait's pretty normal. Nothing abnormal to look at. All right, go ahead and grab a seat. All right, so then we're going to move into our palpation. So maybe go ahead and lay it down on your stomach. Head this way. So we're going to go ahead and palpate proximal to distal. So we're going to go ahead and start down at the PSIS. So we're going to go ahead and palpate right here, coming down to PSIS. Any pain right there?
A little bit.
A little bit. So you got a little pain by PSIS, coming down on the iliac spine. Any pain?
No, it's not bad there.
No? Alright. Going up towards the spine. Any pain right there?
Yeah, it feels,
Yeah? Alright. How about a little bit higher?
No.
No? Alright, so we have pain around L1 to L5. Pain in the PSIS. No pain across the iliac crest. So then we'll go ahead and palpate muscles. As we come in to palpate muscles, we feel muscle tightness due to the spasming of the nerves and due to the muscle spasm. So we feel some tightness coming down on the muscles. So pretty much tight due to the inflamed nerve. Now we go ahead and grab a seat. Sit up for me, please. So then we're going to go ahead and test range of motion. So first we're going to start with trunk flexion. So have you go ahead and slump over like that. Any pain there?
A little bit, I can feel it.
Alright, go ahead and stand up. Sit up. Alright, so I'm going to have you go ahead and extend. Back. Pain there?
A little bit, yeah.
Alright.
Back.
So I'm going to have you go ahead, bring this shoulder down towards the table. Pain?
Yeah.
Yeah. Alright, and same thing on this side.
No, not on this side.
No? Alright, so now we're going to have a trunk flexion. So go ahead and rotate your shoulder this way. Pain there?
Yeah, a little bit.
And then rotate the other way.
No.
No? Alright, so minimal pain. Slight pain on trunk flexion. No pain on, slight pain on trunk extension. Some pain lateral flexion to the left. No pain lateral flexion to the right. And no pain on rotation. Okay, so then we're going to go ahead and do some manual muscle testing. So we're going to go ahead and test hip flexors first. So we're in an uninjured side. So we're going to go left side. So we're going to go ahead, bring this knee up towards the ceiling.
Okay.
Go ahead. Any pain right there? No? All right, I'm going to go ahead and add a little bit of resistance. Go ahead. Pain?
No.
No? All right, we're going to move to the injured side. Same thing. Go ahead and go up.
It's painful, but back here it's not
Painful down towards the leg?
Yeah.
Alright, I'm gonna add slight resistance. Go ahead and sit up straight for me, please. Alright, go ahead.
No.
No? Alright, so then we're gonna go ahead and move to knee extension. So we're gonna test uninjured side first. So go ahead and bring your leg up like that. Alright. Mind for some resistance. Go ahead, push. Anything there?
No.
No? Alright, move to the injured side. Go ahead out, just like that. Alright. I'm gonna add some resistance. Go ahead. Alright. Nothing.
It's only pain when I get my leg out. It hurts like back here.
Alright. So I'll have you go ahead and lay on your stomach. So now we're gonna test hip extension. So we're gonna hit uninjured side first. So have you go ahead and keep your legs straight and bring your heel up towards the ceiling. Alright, just like that. Any pain there?
No.
No, I'm gonna add resistance. Go ahead. No pain there?
No.
Alright, so we're gonna go ahead and move to the injured side. So the same thing. Go ahead and bring that heel up towards the ceiling. Pain there?
Yeah, it feels tight.
Yeah, tight. Alright, I'm gonna add slight resistance. Go ahead. Pain?
Yeah.
Yeah? Alright, go ahead and sit up for me. So we have pain on hip extension, sorry. And then, so then we're gonna go ahead and move on to a special test. So we're gonna go ahead and start off with the quadrant test. So I'm gonna have you go ahead and stand up for me. So you're gonna go ahead and face the wall that way. All right, so what we're gonna do is have him go into extension. So have you go ahead and come back up this way. All right, we're gonna have you go ahead, laterally flex to the left, and then rotate this way.
That hurts.
That hurts right there?
Yeah.
All right, so that quadrant test is indicative for sciatic nerve impingement. Sorry, and then go ahead. You sit on the table here for me. Lie on your back, head this way. All right, so now we're gonna do straight leg raiser. So standing on the injured side, have you go ahead and lift this leg up towards the ceiling. Keep your knee nice and straight. So have you go ahead. Any pain there?
Yeah.
Yeah?
Yeah.
Alright, so we have pain there. That's another indication for sciatic nerve impingement. So then we're going to go ahead and move to the slump test. So have you go ahead and sit up. Alright, so what I want you to do is you're going to have to go ahead and slump over. So roll your shoulders over. Yep, just like that. So I'm going to go ahead and apply pressure at the shoulders. Pain there?
Yeah.
Yeah? Alright, so then we're going to add a second step to this test. So we're going to have a cervical flexion. So have you go ahead and tuck your chin in. And apply pressure at the shoulder and at the head. Pain there?
Yeah.
Yeah?
Yeah.
Alright, so again, to the last step to this test, the same thing, and we're just going to add knee extension. Alright, so same thing, slump test, slump over. Alright, so go ahead and extend your leg. And then bring your toes up towards your kneecap. Any pain there?
Yes.
Alright, so you have pain there. And that's another indication for sciatic nerve impingement. So then we're going to go ahead and move to the Valsalva test. So this test requires you to hold your breath and you push out like you're blowing a balloon. So have you go ahead and take a deep breath, bring your hand up to your mouth, and pretend that you're blowing a balloon. Any pain there?
Yeah.
Yeah? Alright, so we have pain there. That's it. That's an indication for a herniated disc. And then we're going to go ahead and move up to Milgram's test. So I'm going to go ahead and lay down on your back. So I'm going to have you go ahead and bring your feet together. And this test, we're going to have the athlete go ahead and raise his legs off the table about 6 inches. And they should be able to hold it for 30 seconds. If they can, then that's an indication for a herniated disc. So have you go ahead and raise your legs up till you feel my hands. Go ahead. Go ahead. There you go. All right, keep it there and hold there for 30 seconds if you can. As you can tell, we can't hold it, so that's an indication for herniated disc. And then we're going to go ahead and move on to Koenig's test. So Koenig says you're gonna be standing injured side. You're gonna go ahead and have him do a straight leg raiser. So go ahead and do a straight leg raiser. So we're gonna go up. Let me know when you feel pain.
There.
Alright, that's pain right there. Go ahead and bend your knee. Still pain?
Yeah.
Okay, it's pain. So you can tell that's another indication for herniated disc. So then we're gonna go ahead and move on to so go ahead and sit up for me, please. So then move on to my diagnosis. So my diagnosis is we have sciatic nerve impingement due to the herniated disc. My immediate care, ice, traction, and then my long term would be work on core, work on posture, and then also we have him referred to a physician, have him get an MRI just in case surgery might be required, and that's your spine evaluation.